Good morning. I'm going to speak about dry macular degeneration. And as Dr. Mittatelu just said, 90% of macular degeneration is the dry form. 11 million Americans have macular degeneration, and as the population ages, this becomes more and more prevalent. And by the age of 75, the rate of having dry macular degeneration is about 28%. So a very common problem. We'll see if I can advance the slides. What you're seeing in front of you are examples of dry macular degeneration. Dr. Mittatelu also mentioned drusen. And drusen are the yellow deposits that we examine you for when you come into our clinic. Often a person doesn't have symptoms at the beginning, but if they start to accumulate more and more so, you might notice that straight lines become a little bit wavy or crooked, or that the vision diminishes, or eventually that there are spots missing in the vision. And this is a moderate form or a moderate stage of dry macular degeneration. And what we know is that if you come in and look like this, there's about a 20% chance that you'll progress to a worse stage of macular degeneration within 5 years. And that worst stage is either growing a blood vessel in the center of your sight, the wet macular degeneration, and there may be many in the audience who receive regular injections for that, or to the dry macular degeneration where there's a large area of wearing down. So if you come in and one of your eyes has developed advanced macular degeneration, and here the picture shows an area of wearing down, almost like a bullseye, right in the center. And the black and white photo is a new way we have of imaging your eye that shows us the area of wearing down. So if you come in and you have a spot you can't see in the center, and this is your form of macular degeneration, the chance that you get this in the other eye by 5 years is pretty high. It's about 40%. And so it's really important for us to try to diminish that chance over time. And I'll be talking about treatments that have been tried, and including in that vitamins, which has been one of the more successful treatments. When we use this type of testing, so the picture here shows us the little black dots in the upper right corner. And then over time, over a period of 3 years, you can see that this patient's eye has developed larger areas of wearing down. And so this is progression of geographic atrophy. Now, if in the first picture, if you still have islands that allow you to see in the center, you may not really notice that there's a problem. But once those islands of wearing down start creeping into the center of your sight, that's when you notice, well, I can't see in that eye, there's a piece missing. If your other eye is more healthy, you still may not notice it if both eyes are open. Often patients come in when they inadvertently cover one eye and then they realize there's something wrong with my second eye. So the Arid vitamins have been really critical as a population for reducing the chance that you progress. And the Arid vitamins most of you are familiar with because we talk about it the first time we meet people. No matter which eye care professional you see, they'll know about Arid vitamins. And what we can see is that at 10 years, this compared over 1,000 people, and people took placebo, say like a sugar pill, or they took this vitamin that has a number of components, but many of them are antioxidants. And many of you know, we add lutein and zeaxanthin to this vitamin, and that decreased the chance that you'll go to advanced macular degeneration from 44% to 34%. So it doesn't completely eliminate it, but that reduction of 25% in your risk is very useful when it comes to an individual or to a population. So investigational therapies. So what I'm going to start with does not sound very promising. This is a huge public health problem, and there have been many resources placed in trying to find treatments for dry macular degeneration because it's so much more common than the wet form. And we really have better treatments for the wet form at this moment. So one of the things that we noticed is that if you are doing laser for somebody, say they are a diabetic, we noticed that if they had drusen, that they often disappeared. And so in this particular trial that was run by the National Eye Institute, and we were a heavy participant, we lasered one eye in a circle around the center of their sight, and the other eye was just observed. And here is an example. In this patient's eye, their right eye on your left corner was treated with encircling laser around the yellow dot, so not directly in the middle. And their left eye, up in your top right, was not treated. And you can see at 5 years that the eye that was treated really lost most of the yellow drusen, which are the waste products that build up in macular degeneration, whereas the eye that was not treated stayed exactly the same. So we were really, really hopeful that, wow, we've got a great new treatment to try to prevent complications because we can see a physical change that is really impressive. However, clinical trials are really important so that we don't just start doing something because we think with a few patients that it looks like it works. So over 1,000 patients and watching over 5 years, the chances that you lost vision, the chances that you ended up with an area of wearing down, and the chances that an abnormal blood vessel grew in the middle of your vision were exactly the same for the eyes that were treated and the eyes that weren't. And this was in each patient. One eye was watched, one was treated. So unfortunately, this did not end up to be useful. And I am going to talk about some trials that did not work because so that you know what we're asked commonly, is there any treatment? Are you trying anything? And yes, there's always advances being made and work being done because it's such an important problem. So what causes wearing down in the center of your sight or atrophy? And the two main components are that you can build up waste products that can become toxic to the layer under the retina and you get wearing down. The other one is that there can be inflammatory cells. So that's why people talk about the genetics of macular degeneration. Some people are more predisposed to inflammatory, to having inflammation. And the way that we do in all of these clinical trials, we use this, what we call geographic atrophy, so the area of wearing down. We can take those black and white photos and we can determine what's the size of your area of wearing down and does it change as we treat you. And in all these clinical trials, there's a group that are not treated, and then there are several different doses of people that are treated. So two of the more recent ones, one was a medication called sirolimus, meant to decrease inflammation, and another was called isixostab, made by Acucella, and this is supposed to slow down your metabolism in the eye, and hopefully that way you wouldn't build up toxic waste products. So the sirolimus study was fairly small at the beginning. We start with smaller amounts of patients, and if it looks promising, clinical trials recruit many more patients. And here, this one started with 50 patients, again, looking at the area of wearing down like you see in this patient, and could you prevent that from getting worse? They had monthly visits for 2 years. So many of these trials go for 2 years. Sirolimus is injected in the eye. Many patients here, again, are used to this process, and Dr. Chang is going to talk about wet macular degeneration shortly. So the results did not show any difference. So for the patients that received these injections for monthly for 2 years versus those who were observed, really the area of wearing down was exactly the same. So this did not work. So the other medication that's trying to slow down your metabolism, again, this was an oral medication, which would be great. It'd be nice to avoid having to have injections so often. It's a big burden for patients. And this was also a 2-year trial. And unfortunately, in this one as well, the area of wearing down was exactly the same, except they also had side effects. So they had troubles with night vision, troubles with their color vision, and some had loss of vision. So again, another medication that didn't work. And then the most recent was one called lampalizumab, and there was a lot of excitement about this one, another huge trial. This one recruited 1,800 patients because it was so promising in the first phase trials. And again, no meaningful difference. So I'm not trying to be discouraging, but to show you that right now, some of the managements are more adaptive managements to your macular degeneration rather than treating somebody with a medication, but there are clinical trials still going on looking for a better treatment. This is the implantable miniature telescope. So the implantable miniature telescope is a way to take somebody who's got an area of wearing down in both eyes and has lost their central vision to try to recover some central vision. And it's done in the same way that we do a cataract surgery, except we make a bigger incision and we place this lens instead of a regular lens, and Medicare covers this lens. And so here is an example of a patient trying to look at the word cat. except, we'll see, they have an area of wearing down, and it completely covers the word cat. Now, if you put the telescope in, it blows up the word cat, but the area that's worn down did not get bigger, so now you can make out that that's the word cat. And these are some examples of a patient in the clinical trial, and they're exaggerated a little bit. The benefit is not really as good for everybody as it is for this patient. Here they can't see their grandfather's face, or they can't see their spouse's face. And if you put on a telescope that's on a pair of glasses, you can see their face more magnified, but you still have that area. You've also magnified the area you can't see. But if you put a telescope inside their eye, they are more likely to be able to see the face because you're not magnifying the small dark area that you have. So the 2-year results, 60% of people improved 3 lines on the vision chart. So that's a pretty good improvement, and for some returns their ability to recognize faces or to read. And again, this is really only for people who have lost central vision in both eyes, and they end up using one eye to get around and navigate, and they use the other eye to see centrally. So this is there, and it's not without risk. There are people that get damage to the cornea of their eye with this type of surgery, but it can be useful. Sorry, advancing is sort of slow. So there is a talk later about stem cells, and here we're not using a medicine to try to treat macular degeneration, but actually replacing the tissue that has been damaged in the center. And Dr. Gam will give a lot more detail about this. But it is part of the treating of dry macular degeneration. And here you can take your stem cells, so they can be, rather than being embryonic, they can be personal to you, and they can be reprogrammed to produce retina and to produce the retinal pigment epithelium, which is the layer that wears down below the retina. And so that has been in development with a couple of groups. And a publication came out a couple of years ago showing proof of concept. Can you implant the tissue? Can you see it with our imaging? Does it look like the patients have side effects when you do this? And what you see on the photos, the gray and white photos are sideways pictures of the retina, and many of you would have these when you come to our clinics to see how you're doing with your macular degeneration. And this showed that some of the tissue that was implanted appeared to stay where you put it and to be viable. And there were a couple of people that had improvement of vision. And this is really early days for stem cell therapy. In California right now, there's a project for a bioengineered stem cell retinal pigment epithelial layer. So here they've constructed a layer that tries to allow nutrients to pass through. And on top of that, they've put stem cell-derived retinal pigment epithelium. And here, the way that you do this is you do a surgery, make a cut in the retina, and put this implant underneath the retina in the area that's worn down. And that's what you see in the bottom left picture. Almost looks like a little anvil that's been placed underneath the retina in the area where you need it. And that has also shown some viability in the 4 patients in which it was placed, that they did not have bad side effects. So it's only been 4 patients so far, but again, for you to know that there are clinical trials looking at replacement of tissue that has been damaged, especially for people who already have damage. It's really important to try to prevent progression with medicines, but if you already have damage, this might be the treatment of the future. And so for summary, there are drug trials that have not been successful to date, but there will be more that come. Ocular vitamins are really important because they are shown to decrease the progression of dry AMD into either wet or severe atrophy. Assistive devices can be really, really helpful, and you have a whole room outside that is full of people and tools that can really help you manage. So you should take advantage of that. And tissue replacement with a stem cell construct holds promise for the future. Thank you.